Together, we said from the start that the problem with this COVID non-inquiry was that it was an insult to everyone because its terms of reference and its terms of inquiry were utterly flawed. When you're not prepared to consider the merit or the virtue or the efficacy or not of the actual lockdowns, something that had never been done before, that was the thing that was utterly unprecedented, and how they have an impact not just on any disease or not, but also on all of the other areas in terms of health, psychology, the economy, infrastructure, on everything that's happened. And this spending of our money again, another 200 million quid on top of the billions that were spent absolutely terribly, has been an insult, and it's gaslighting us, and it's saying the same thing that Keir Starmer tried to say, which is if only you just have done this just a bit earlier, everything would have been resolved. Using, by the way, modelling from Niall Ferguson and others, utterly incapable of or unwilling to bring in other reference points, other peer-to-peer research, all of which had shown various graphs and data and evidence that we should not have been locked down. And also, of course, looking at other models, like in Sweden, where you had a far better response and a far better outcomes. So all of this demonstrates, unfortunately, this COVID inquiry is an insult. And what we really need to do, Kevin, and this is why Together is here now, we're not going to have this happen to us. We're organised up and down the country. We just had an event, with very well attended. We're now going to be making sure that around digital ID, which was the direct lead on from what had happened with so-called vaccine passes and the mandatory jabs, all of which we all fought together and challenged and stopped. And frankly, this inquiry is just utterly insulting to the whole of the British public and all the people that were locked away, all our elderly, all the best of our generation, and all the children that are impacted, and the 7 million waiting list on the NHS. On and on the list goes. The damage to the economy, 20,000 hospitality venues lost. On and on we go, right? It was utterly terrible, and it's just insulting that at the end of this and all this money that's been spent, that they've come to this position. But I think that, like with many other things now, Kevin, the public's looking at this, just like the public is now not renewing the BBC licence and saying we've had enough of all this stuff. We're just not going to go down the same road again. We've got a situation where no one was asking why it was that Valence was saying some things at the start of this and did a U-turn. Boris and the administration should be and can be criticised for many, many things. His U-turn on a sensible approach that Sweden had, his saying that he'd eat any ID card and then pushing vaccine passports, a whole array of things, that locking down the whole nation, should have been held accountable for all of those things along with others in the cabinet. And yet what we saw was farcically being held accountable for whether there was cake and Coca-Cola or wine or not. And this is just a disgrace. The seriousness, the way it disrupted society, the way it the way it impacted so much that we're still having to deal with now in all sorts of areas. In the
massively, Alan, massively.
The economy, the debt.
Culturally, socially.
Everyone was put into a state of fear. They were peddled something. We were told originally it was only for a certain demographic, and then they were pushing it to children as young as 6 months in America, and pursuing it and threatening people with their jobs and other things. Utterly unacceptable. At togetherdeclaration.org, people should keep an eye out on this. We're going to be doing some more work about this. We delivered the Perseus report with Hart and many others to the UK HSA, saying there should be the same standards that we have in manufacturing and food. We should have that. And I'll consider things like Gavi and the different organisations that are involved unacceptable, the way it was peddled and presented, and also what the consequences are far higher, the impacts and the harms, than any other procedure that has been in the last 3 decades. So lots of serious questions, a huge problem that we upended hundreds of years of medical notions of autonomy and informed consent, and absolutely needs to be addressed. And the problem that there's been avoiding litigation, and we've seen all sorts of things of not being willing and actually having it obscured, the data and the information and links to deaths and everything. It gives us big pause. The public should always be front and centre, not technocrats, not big pharma. It should be what the public needs and what the country needs. And that's why together we're now organised and determined to make sure we put that front and centre, and we'd encourage your viewers and listeners all to get involved with that.